anger management are now part of our culture. Judges have ordered it for out-of-control spouses. Some companies offer classes in it for their employees. Our resident psychologist, Dr. Joanne Stephenson, is here to offer us some insight on why people become so angry and what to do about it. Dr. Joanne, it's always a pleasure to speak with you.
Hi, Brittany. I'm glad to be here.
Now, first off, what defines an anger problem as opposed to just being angry?
Well, that is a good question, and we need to start with children explaining this. Anger is a normal reaction. It's a normal feeling. It's a good emotion. It's how we use our anger. We can use our anger in productive ways, but when it gets out of control, when we lose control, when we're hurting somebody, when it's causing problems, we need to do something about it.
Now, you said hurting people, causing problems. Is that hurting people physically, or is that hurting people just in any manner?
In any manner. You know, today we have a real problem with anger becoming violence. And we see this with teenagers, we see it with road rage. Too many people are acting out their anger and physically hurting people. But words can be hurting too. You know, when you're using verbal violence towards someone, you really can hurt them psychologically.
Now, how much of anger is nature and how much is nurture?
That's another excellent point, because temperament is part of this. That's the part of our personality we're born with. And some people just have a more of a leaning toward being an angry type person. Some people are easygoing, you know, so it can be part of our personality. And then what do we have modeled for us? How do our parents handle anger and frustration and all those things? How do our teachers, the other people around us, and our role models, our heroes?
Now, if you grew up in a household where there's a lot of anger shown in a negative manner, what long-term effects does that have on a child?
It can be very harmful to them personally, because it causes a lot of fear in children to be around anger all the time. And it's going to give them more of a leaning toward being an angry person and a hostile person who acts it out.
Now, there's, you know, Alcoholics Anonymous programs, other type of anonymous programs. Is there like an anger anonymous program?
There should be, and I think we'll see that, because today things are getting way out of control. And getting therapy for anger management is real important. You can learn to control it yourself. It's one of those things that's an emotional intelligence. You know, if we are really aware of our feelings and aware of how easily we become angered, we can control it better. Some people are the type A people who are anger-prone people. They can be aware of that and try to control it. Try to be less impulsive. Now, in a lot of people, they have an emotional hijack where their impulsivity, being impulsive, they act out their anger too quickly. We have the rational part of our brain that's supposed to filter that. If we're aware that we're a person who is too much the anger-prone person, we can learn to be aware of it, be aware of our feelings, and of not to be too impulsive. But we've all been there where we think we're fine, somebody just really angers us quickly, and we react to it too impulsively. Now,
realizing that you become angry impulsively, is that something that people typically do on their own, or is that something that has to be pointed out to either a loved one or pointed out from, you know, maybe a professor at a university?
We think these people should know. You know, duh, have you noticed people avoid you? But somebody near them needs to really talk to them. Sometimes they're not aware of how much of a problem it is. Some people think they're just being assertive, but being assertive is not being aggressive. You know, when you're aggressive, you're acting out on your anger, and you are causing harm to someone else or causing problems for yourself.
Now, when we think of anger, we think of aggressive behavior, but it also seems to rear its head in passive-aggressive behavior. How does that happen?
Yes. Where someone doesn't overtly or you very in your face take care of it, but they're going to be a little sneakier and more subtle and try to get you in ways that are not so obvious, but they know what they're doing.
Now, we talked a little bit about anger management programs. What role does talk therapy play in that? And then is there ever an instance where they would have to go to medication?
Well, it depends on the person and their temperament, their personality, their life situations. Stress has a lot to do with this. That brings out the worst in us and frustration. Of course, talking in therapy is always very helpful. Someone who can lead you through better techniques, better ways to handle your impulsivity, better ways to handle your own feelings and be aware of them. And then medication for some people is helpful too. You know, we're finding the behavior cognitive therapy is very helpful in situations like this, trying to change your thinking and your behavior.
Well, Dr. Joanne, it's always a pleasure to speak with you. And
always great to be here.
It's great to hear great things about how to control your anger. But when we return, a recap of today's headlines and a look ahead at weekend weather as Jackson 24/7 continues.